Hello. Hi everyone. This is Dr. Arpita Sharma. I am working as a consultant psychiatrist at Emoneeds Gurgaon. So आज का टॉपिक ऑफ डिस्कशन जो है हमारा है वो है अंडरस्टैंडिंग मेंटल हेल्थ। बहुत ही कॉमन एक बेसिक सा टॉपिक है जो आज हमने चूज किया है डिस्कस करने के लिए, बट येट वेरी वेरी इंपॉर्टेंट बिकॉज वी सी a lot of indiscrepancies and myths related to mental health. तो आज हम इस वेबिनार के जरिए सारे जितने भी मिथ्स हैं वो क्लियर करेंगे मेंटल हेल्थ को लेके। वी विल अंडरस्टैंड इन डेप्थ कि मेंटल हेल्थ एग्जैक्टली क्या होती है, हाउ अ पर्सन कैन गेट मेंटल हेल्थ इश्यूज एंड whom and which professional to approach if anyone is suffering from any of the mental health concerns which people can have. सो पहली स्लाइड में ही मैंने एक रखी है कि जस्ट लेट मी जस्ट आस्क यू वन क्वेश्चन कि एनी वन ऑफ यू नोज द प्रिविलेंस ऑफ मेंटल हेल्थ, कॉमन मेंटल हेल्थ इश्यूज जैसे डिप्रेशन हो गया, एंजाइटी हो गया, कितना है हमारी पॉपुलेशन में? हाँ। सो मेंटल हेल्थ कंसर्न्स जो हैं, इश्यूज जो हैं, 1 in 4 मतलब 4 में से एक इंसान जो है उसमें मेंटल हेल्थ इश्यूज, बी इट अ माइल्ड और मॉडरेट और सीवियर मेंटल हेल्थ इशू, it's that prevalent. But how many people take help from a mental health professional when they're suffering from mental health issue? It's less than one. It's in negatives, it's in points. So that figure is very worrisome for us because that clearly tells कि ज़रूरत कितनी ज़्यादा लोगों को है, सफ़र कितने ज़्यादा लोग कर रहे हैं, बट स्टिल लोग हेल्प नहीं ले रहे हैं। इवन आई बिलीव दैट आए दिन हम अपने सोशल मीडिया के ज़रिए, बी इट अ न्यूज़पेपर, इंस्टाग्राम, यूट्यूब और एनी अदर सोशल मीडिया प्लेटफॉर्म, we come to know about some or the other person suffering from anxiety, depression or something else. So this next slide, which I took, I was just scrolling my Instagram and I found this news. So what I did, I read कि हाँ, one techie from Bangalore, he jumped from a building and he committed suicide. So we as the citizens of our country, what we do, we आए दिन हम इन न्यूज़ के बारे में पढ़ते रहते हैं, देखते रहते हैं और हम बस स्क्रॉल करेंगे एंड देन वी विल सी कि ऐसा क्या था कि जंप कर लिया, किसी से हेल्प ले लेता, किसी से बात कर लेता, शायद कोई ना कोई सॉल्यूशन निकल आता, and then we move ahead, and then next day again we hear about the same thing and we pass the same comment and we move forward. So these news, these are all the cause of concern for all of us because किसी भी इंसान को मेंटल हेल्थ इश्यूज हो सकते हैं एंड मेंटल हेल्थ इश्यूज अगर बहुत सीवियर हो दे कैन एक्सटेंड टू a person taking a step such as committing a suicide. So this is concerning. This figure is concerning. So we all come to know about people suffering from the issues, but yet no one takes any help. लोग जो हैं वो बहुत ही कतराते हैं, बहुत ज़्यादा कतराते हैं कि हेल्प लेनी है, नहीं लेनी है, वो सीख नहीं करते हैं और उस चीज़ को हम कहते हैं स्टिग्मा। ठीक है, जैसे फॉर एग्जाम्पल किसी को पेट में दर्द हो रहा है या हेडेक हो रहा है तो सिम्टम्स आर वेरी मच विजिबल, तो हम कहेंगे कि हाँ ये तो प्रॉब्लम है, अब तो डॉक्टर के पास जाना पड़ेगा। लेकिन मेंटल हेल्थ इश्यूज, मेंटल हेल्थ कंसर्न्स, मेंटल इलनेसेस इतनी विजिबल नहीं है। जस्ट बिकॉज इट इज़ नॉट विजिबल टू अदर पीपल डजेंट मीन दैट इट इज़ नॉट रियल। ओके, सो हम ऐसे नहीं कह सकते कि प्रॉब्लम विजिबल नहीं है, हाँ उनको हाथ में फ्रैक्चर नहीं आया, दिख नहीं रहा है तो प्रॉब्लम नहीं है। Okay, so that is all stemming from the stigma which we as a society have to take help for the mental health issues which we are currently suffering from. अब stigma कहाँ से stem होते हैं? There are 2 3 things from where I feel that stigma stems from. One is the preconceived notion we have for a mental illness. When we think about a person who is mentally ill, what comes into our mind? आई एम श्योर कि हमारी इमेजिनेशन चली गई होगी कि कोई भी इंसान वॉन्डरिंग एमलेसली ऑन रोड्स, अजीब तरीके से बात करना, पोअरली कैम्ड, नॉट वेल ड्रेस्ड, सो दैट विद दैट थिंग पीपल रिलेट a person having a mental illness. But that can also be one of the reason that people don't want to be labeled as that they are mentally ill, so they don't go to a doctor who treats mentally ill people. That can be one of the reason. Or the other reason can be that people don't know how and when to take help. क्या ये मेरी प्रॉब्लम्स हैं जो मैं सफ़र कर रही हूँ या कर रहा हूँ, क्या उनके लिए हेल्प अवेलेबल है? सो देर कैन बी 2 factors. So when we address these factors, Let me address the first factor, that the picture we create in our mind for a person who suffers from mental illness, right? So that also we will read, we will learn in my next slides. And the second thing is that awareness and what is mental illness, when to take help, that also I will cover in my subsequent slides. So let's just proceed one by one slowly and highlight करते हैं दोनों चीज़ों को कि हाँ exactly reason क्या हो सकता है. ओके, सो अभी तो मैंने आपको बता दिया कि व्हाई इट इज इम्पोर्टेंट टू टेक हेल्प विद रिगार्ड टू द मेंटल हेल्थ इश्यूज. So WHO has given a very beautiful, good definition about the concept of holistic health. When we consider that the person is healthy, according to you, hmm? Right. So, I get the answers like if I'm able to do my daily routine in time, I'm able to feel happy, I'm able to use all my body parts, I'm able to take care of my family members, I'm able to go to the job, I'm able to eat properly, breathe properly, etc. etc. Yes. So in nutshell, ये सब examples हैं, which means that we as individuals are healthy. So the definition which the WHO gives, which we read, when I was doing my MBBS, I used to read this definition then and there, that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So a person is said to be healthy if he is completely healthy physically, कि physical issues कोई नहीं है, mentally healthy है, mental issues नहीं है, and socially healthy है. What is the meaning of socially healthy? That the person is able to take care of his social obligations. And it doesn't mean that disease नहीं है या infirmity नहीं है तो patient जो है, sorry, the person जो है वो healthy है. इंसान हेल्दी तभी है जब वो फिजिकली हेल्दी है, मेंटली हेल्दी है और सोशली हेल्दी है, और अपनी ऑब्लिगेशंस, अपनी नीड्स जो हैं, अपनी ड्यूटीज जो हैं वो फुलफिल कर पा रहा है. अगर हम मेंटली हेल्दी नहीं हैं तो हम हेल्दी नहीं हैं, हम फिजिकली हेल्दी नहीं हैं तो भी वी कैन नॉट से वी आर हेल्दी. सो हेल्थ इज द utmost priority, for we as human beings. We are doing lots of work, we are struggling, we are excellent in our professional sphere, in the other spheres of life, we're taking care of the social responsibilities also. But once our health is at stake, we have a lot of things to do, but once our health is at stake, then we understand, then we prioritize that जितनी भी टास्क हम दिन भर कर रहे हैं, जितनी भी चीज़ें हैं हमारे लिए सॉल्व करने के लिए, जब तक हम हेल्दी नहीं हैं तब तक हर चीज़ जो है वो बैक सीट ले लेती है. So, health should be the topmost priority. And when we talk about health, it is not just physical health, but the mental health, the physical health, the social health, and ultimately our holistic health as a human being. So, right, now you understood कि concept of health कहाँ से आ रहा है. सिर्फ physically healthy होना ही का मतलब नहीं है कि आप ओवरऑल होलिस्टिकली हेल्दी हो. एंड हेल्थ जो है हमारी लाइफ में एक utmost priority होती है. Right. So the next slide I'm moving on to. Yes, the mental health continuum. So when we talk about mental health continuum, so this slide is very important in the sense that we need to understand when we can seek help and support from a professional or from our loved ones. So mental health जो है वो continuum में रहती है. जो ग्रीन आप देख रहे हो ना, ग्रीन इज पॉजिटिव एंड हेल्दी, एवरीथिंग इज फाइन, पर्सन इज एबल टू मैनेज every duty, every responsibility, every role he or she has, and there are no major issues which are causing any dysfunction in his life. Then red aa jata hai the people who are suffering from severe mental illness. So the example which we took initially, when we think about people who are having mental illnesses, कि someone wandering on roads, not able to take care of themselves, so हम उन्हें put करते हैं suffering from severe mental illnesses. And कहीं ना कहीं सीवियर मेंटल इलनेसेस में के बीच और दूसरा कॉन्टिन्यूम जो पॉजिटिव एंड बीइंग हेल्दी है, उसके बीच में कॉन्टिन्यूम आता है कि लेस एबल टू डील विद द थिंग्स इन डे टू डे लाइफ. फॉर एग्जाम्पल, having some difficulty in workplace, difficulty in maintaining professional as well as personal responsibilities. They're able to go for a job, but they're feeling very tired, exhausted, anxious, depressed, sad, but still they are managing somehow. But that whatever they are managing, that is coming with a lot of difficulty. The other way also, that they know the stresses are there, but they are somehow pushing here and there, The effort is too much that it can be less effortful also, but they are doing one task, and that task is causing taking a lot of toll on their health. They're not able to sleep, they're not able to sleep in the night, they're feeling anxious, and next day they're going to job, and there they are not able to perform better. They're emotionally very reactive, they're emotionally very overwhelmed, they feel overburdened almost most of the times. So this yellow, the yellow part which you are seeing, ये पार्ट बहुत बहुत इंपॉर्टेंट है. लोगों को लगता है कि हमें सीवियर मेंटल इलनेस नहीं है तो हम एक मेंटल हेल्थ प्रोफेशनल के पास नहीं जा सकते. बट प्रॉब्लम ऐसी है कि इवन फॉर इश्यूज विच आर कॉजिंग अ डिसफंक्शन इन योर डे टू डे लाइफ विच आर नॉट एज सीवियर एज मेंटल illnesses per se, but still they are making the daily routine very difficult. For these issues also help is available, राइट. सो जो सेकेंड चीज मैंने बताई थी आपको कि स्टिग्मा या तो है कि हमें पता नहीं है कि कहाँ कहाँ हमें हेल्प मिल सकती है एक मेंटल हेल्थ प्रोफेशनल से. सो यस, दिस ग्रीन सर्कल डिपिक्ट्स दैट these issues like people struggling in their personal relationships, professional relationships, having anxiety, having depression, suffering from or struggling with addictions like smoking, alcohol, which they are managing but they're not able to deliver on time the tasks which they are required to do. So, these all problems can be tackled professionally if you take help from a mental health professional, right? So we know that severe mental illnesses वाले जो लोग हैं definitely they require help from a psychiatrist or a psychologist. But these issues, the issues which are coming in this yellow circle, for these issues also help is available. So I feel now you people are aware कि हाँ इन सब चीज़ों के लिए भी मैं किसी एक mental health professional के पास जा सकता हूँ या जा सकती हूँ. Right. So yeah, now when we talk about how a person can get a mental health issue or mental illness, so the very common model which we as doctors use is biological, psychological, and sociological model. We call it biopsychosocial model, right? So why we need to understand biopsychosocial model? Because many times patient come to me and they are like, हाँ job भी तो गई है ना, ये क्यों depress हो गए? मेरी भी तो जॉब गई थी, बट आई डिडंट गेट इनटू डिप्रेशन. व्हाई दिस पर्सन गोज इनटू गॉट इनटू डिप्रेशन व्हाई मी couldn't. Me, I tackled it with searching for other jobs, speaking to other people. Why this person got into depression? मुझे समझ नहीं आया. Okay. So how a person can get by a psychiatric issue or psychiatric illness? Let's just understand with the analogy of a person who is having diabetes or sugars. So if you can tell me how a person can get diabetes or sugars. Okay. So usually we say there are two factors which can cause a person to get into such kind of illnesses. For example, family history of diabetes. अगर family में diabetes चली आ रही है, sugars चली आ रही हैं, parents को है, grandparents को था, uncle auntie को था, तो there is a possibility that you are also predisposed to getting diabetes in your life. That is one factor which is genetic or family. Second factor is environmental factors. If the person is very obese, वो बहुत ज़्यादा शुगरी फूड कंज्यूम कर रहे हैं, एक्सरसाइज नहीं कर रहे हैं, वेट बढ़ता जा रहा है, सो ऑलरेडी अगर वो बायोलॉजिकली प्रीडिस्पोज्ड हैं बिकॉज ऑफ देयर फैमिली हिस्ट्री, देन द इन्वायरमेंटल फैक्टर्स जो हैं वो भी हैं साथ में, देन द पर्सन विल गेट डायबिटीज एंड the insulin levels will fluctuate. How we treat diabetes? We'll say, okay, you take the medicines, anti-diabetic medications, and that will control your insulin levels, blood sugar levels, and then sugars जो है वो under control हो जाएंगी. And the second advice we give कि हाँ, now don't consume excess of sugary food, start working out, start decreasing your weight. So that way also the person will have good control of diabetes, good control of sugars. The same way, a person who gets a psychiatric illness, it works. A person who is familially predisposed. What does that mean? If a person who comes from a family who which has the history of psychiatric illnesses like depression, anxiety, bipolar, etc., the person is already predisposed to getting these illnesses. And if the environmental hit occurs, there are some stresses in the workplace, in the professional life. So all these contribute to some disruption in the neurochemicals in our brain, and that will lead into symptoms of depression, anxiety, and other psychiatric illnesses which the person suffer from. So everybody can have different threshold of any stress to develop a psychiatric illness अगर वो ऑलरेडी बायोलॉजिकली सेंसिटिव हैं. इसीलिए सेम अमाउंट ऑफ स्ट्रेस विल नॉट कॉज सेम काइंड ऑफ इलनेस इन ऑल द पीपल. सो वन पर्सन जिनकी जॉब चली गई है or he can cope very well, he will not go into that state of depression, and he will come out very well. But the other person, if same thing happens to him who is already biologically predisposed, if still he gets loses the job, that environmental stressor come, he can land up into depression. So for every person, the brain sensitivity is different, and every individual is differently wired to get predisposed to such kind of illnesses. Same like the other lifestyle illnesses like diabetes and hypertension, which I gave you an example. Okay, so now I guess that you got a very simplistic model idea how a person can go into a psychiatric illness. Same way, biological, psychological, and social issues, they all come together and they predispose a person, and the person can get issues, psychiatric issues. So, why I explain such a big model which we as doctors usually read, because I feel that इसको समझना important है कि हम हर एक इंसान जो एक साइकाइट्रिक इलनेसेस या साइकाइट्रिक इशू से गो थ्रू करता है, उसको हमेशा ये पूछा जाता है कि कॉज क्या है. जैसे मैंने आपको एग्जांपल दिया कि रिलेटिव वुड कम एंड आस्क कि मुझे तो नहीं हुआ, इनको क्यों हुआ. सो आई गेस नाउ यू हैव a slightly fair idea how one person can develop an illness and the other person will not, just because the stresses are same. Okay, because every individual has different response to the stressors. Okay, so this I have just attached one slide here. They are explaining my reviews I got from the online platform. So what profile of patients usually visit us? Yes, there are patients who visit for severe mental illnesses like schizophrenia हो गया, bipolar disorder हो गया, या severe addictions हो गए. But major chunk of people who visit in our OPD, who take help from us, they are for that people who come from that yellow circle. One person he visited me for just low confidence because he was not able to do well in his college life. He felt that he could do better, so we worked on the confidence. Then some other patient he visited for anger management, that he was very emotionally reactive. So even these kind of issues can be helped, and one should not hesitate to seek help from a psychiatrist or a psychologist if they are going through such problems, because ultimately that is affecting their quality of life. They're not living to their fullest potential. They are not the way they think they should be. They can improvise. Their life is okay, but it can become better. So many of the problems which we think कि ये तो कोई help नहीं available है, कैसे हम change कर सकते हैं, but yes, help is available. You just need to talk to the professional and seek some guidance. Yes. So how we can improve? I have added a very small slide. Nowadays, because the life is very fast paced, so what steps we can take from our end so that we can improve our mental health. So here are some of my suggestions which I feel will work for you. The one is the daily practices for mental well-being. That exercise should be regular, at least 3 times or 4 times a week. We should do a physical activity, a physical exercise, because that same definition of WHO, that mental health and physical health, they go hand in hand and they both depend on each other. They are interdependent. Physical activity will keep us physically, regular exercise will keep us physically as well as mentally healthy. It releases good chemicals in our brain, which makes us feel better, which makes us have a good control in our life. Second is healthy diet. Whatever you are eating, that should be healthy. It should not be junk. There should not be any emotional eating happening. So healthy eating also is a one good step which we can take towards our mental well-being. Doing some relaxation exercises like mindfulness and meditation, talking to people, talking to your family members and friends, reaching out to them when you are in problem, and when the problem is slightly severe, when it is not being getting controlled with talking to your friends or people, then professional support should be sought whenever it is required. So these are very basic simple strategies which we usually take when we talk about mental well-being. Second thing is, what is your role as a professional? What is your role as a professional what is your role as a society when you talk about taking care of mental health? So, First of all, that your role is that you should provide a non-judgmental space to whoever who is seeking help. For example, if you come across some person who is struggling emotionally, you feel that he is not doing well, he could have done better, or he's not to himself at the point, देखने में सैड लग रहा है, इन्वॉल्व नहीं लग रहा है एक्टिविटी में या वर्क प्लेस में, तो आपका रोल होना चाहिए दैट यू शुड एनकरेज द seeking of help. You should talk to them, you should listen to them non-judgmentally and see what issues are they going through, and providing a non-judgmental support whenever required. So that is one thing which you can do from your end, and not judge the person ki oh this is so emotionally weak person, itna bhi stress ये tolerate नहीं कर पाए. So providing a non-judgmental space, safe space to your colleagues, to your friends, to your family will be the best thing you can do to someone who is struggling mentally or emotionally. That is one thing. And the second thing, if you feel that the other person is at risk कि उनको हेल्प मिलेगा अगर वो एक मेंटल हेल्थ प्रोफेशनल से बात करेंगे, तो यू शुड लिंक देम टू अ मेंटल हेल्थ प्रोफेशनल. जो भी नियर बाय साइकाइट्रिस्ट या साइकोलॉजिस्ट अवेलेबल हैं, उनको उनके साथ आप उन्हें लिंक कर सकते हैं. तो दैट विल बी द रोल विच यू कैन प्ले एज अ फैमिली मेम्बर और एज अ फ्रेंड. So, seeking help from a mental health professional is an important step towards mental well-being whenever required. So, there are three types of mental health professionals. There are psychiatrists, psychologists, and the social workers. Psychiatrists are usually MBBS, MD doctors. They are doctorate of medicine in psychiatry, and they are trained to treat the patient with medications, as well as they're also trained in doing psychotherapies, but only psychiatrists are licensed to give medications and, if required, therapy. Whereas psychologists are, they have a master's in philosophy degree in psychology, and they work usually with the domain of doing therapies, but they cannot prescribe, they are not licensed to prescribe medications. They are only authorized to do therapies, and if any medication is required, the psychologists usually refer the patients to psychiatrists. And the social workers, they usually work with people who are having familial issues, marital issues, or interpersonal issues. So social workers who are trained in psychiatry can also be approached. So these are the three different kind of mental health professionals whom you should approach if you are having any kind of psychiatric or a mental health issue. So psychiatrists are the people who are the medical doctors. They are licensed to give you medications, and many times many psychiatrists, they do therapy as well. Psychologists, whereas only therapy. If required any kind of medication support, go to a psychiatrist. If you feel like that you just want to take therapy, both psychiatrists as well as psychologists can be approached. So these are the mental health professionals which are usually available, and you can seek help from any of them, whomever you are comfortable with. So access to mental health care is also important. Government is also coming up with a lot of schemes because they understood the importance of mental health after the COVID hit and when the lockdown happened. So a lot of programs related to providing the mental health care are being taken care at the moment, and you also have to make sure that everyone nearby you should get the required support whenever there is a need. So you can link them to a professional. We need to understand that we have to prioritize work-life balance to maintain our mental well-being. So we should, in our office space also, we should encourage everyone to set a set boundary so that we can spend time with their families as well as with the families, and that segregation is very important because nowadays that boundary is very much blurred. There is no clear work and work because of work from home and other stuff. So a proper work-life balance is also important to have a good mental health. That is one of the other thing which the company should promote in their workspace. So now we have come to the end of the webinar, and I'm sure that it must have helped you. It's the topic was very basic, understanding mental health, but side by side it is very important as well because many a times it is ignored, but it should be most prioritized. We are getting affected, but still we are not seeking help, and we are just going into that negative vicious loop, and we are feeling stuck, and ultimately the things are getting worse. So timely help, first of all we should understand that we how we can prevent any mental health issue, any mental health concern by taking care of our mental health. The points which I highlighted in the webinar. Second thing is, once the person is suffering from a mental health issue, if that is causing a lot of dysfunction in his personal sphere, professional sphere, in his life, then he or she should seek help, and from whom he or she can seek help, that also we have slightly touched upon. So, any questions anybody has can ask in the chat box. Okay. If there are no questions, so I will just conclude my webinar. And in case anyone needs any kind of mental health help or support, you can reach out to us. We are based out of Gurgaon at Emoneeds, and you're very welcomed for any kind of support if we can provide. Thank you.